So very good morning. So today we are going to discuss about collection and the preservation of urine. This is Dr. Fern. So in certain important consideration are to be borne in mind related to the collection of urine specimen for examinations. The very serious error in the interpretations of result may be obtained if the following methods are not applied carefully, because the collection or the preservation or analysis of urine is very important, because the urine test or analysis of urine is very basic and the primary diagnostic tool in medical field. Each and every human being or excrete or animals excrete the waste through urine. So the urine is one of the main specimen is considered in the medical field of diagnosis to identify the conditions or the unwanted microorganism is present in the system. So the collection of urine for screening purpose for chemical and microscopic examinations, the clear voided early morning specimen are also 2 hours after the principal meal are suitable, because the early morning urine may contain highly concentrated. In that condition, we can identify even the microorganism or any sick causing agent present in the initial stage or low concentration. Because after the last passing of urine or last night, the till from 10 p.m. and then just calculated the 5 to 6 p.m. the the urine is stored in the bladder for almost 5 to 6 hours or 8 hours. It becomes so concentration. So in that view, the early morning specimen collection is preferred for urine test. And the urine pH is normally the slightly acidic of 6, which preserved the formed elements of erythrocytes, leukocytes, epithelial cells, cast crystals. The early morning specimen is particularly collected for detection of HCG hormone for pregnancy, the human chorionic gonadotropin. In that case also, the early morning specimen is highly uh, remarkable and markable for reporting for result. And the fasting glucose level for diabetes mellitus. The specimen collected about 3 hours after principal meal is most suitable for searching the abnormalities in metabolism, because the principal meal may be the night or the morning or the afternoon. After once you had the meal in the big level, it get digested and absorbed. And after that, for that we recommended the patients to collect the specimen after 3 hours of the meal. The postprandial the specimen are used for the analysis of glucose, urobilinogen, and creatine under the special circumstances. For a screening purpose, 300 ml capacity container is used for collection of urine specimen. Okay, 300 is the most preferable one. And the 24-hour specimen is collected for many assays, such as for the detection of urobilinogen or xylose accretion, hormones, proteins, electrolytes, and the quantitative cell count. So error in the results of quantitative urine examination are more often related to collection problems. The early morning urine specimen is discarded, and all the urine during the next 24 hours include the early morning urine of the next day is collected. The 5-liter capacity container is used for 24 hours urine. Sometimes we go for a condition of the kidney nephron or the entire system. The physician advised for monitor 24 hours urine. For 24 hours urine, it may may be the maybe the patient's in fluid it may increase to more than 1.5 liters. So they usually in uh, 24 hours we calculated uh, 1.5 liters of urine the kidney is supposed to be excreted. Okay, for that we used a 5-liter bag and the collection of urine for bacteriological examination. The midstream of urine specimen is required for bacteriological examinations. About 30 to 100 ml of clean, voided midstream urine specimen should be collected. So, 30 ml to 100 ml, the clean voided, the midstream, the in collection of the urine, the word is on and off using the midstream because any uh, microbiological, microbiological or bacteriological or microorganism examinations, or if it's suspected by the bacterial infection or viral infection or fungal or whatever it may be, we should collect the only the microorganism present in the urine. That's why if we collected from the initial stage of some liver sickness, the microorganism may present in and around the urogenital tract. So the advised to collect first few minutes we should not collect and last minute we should not collect the mid urine only the stream of the flow will collected by the physician or the patient. But catheterization or suprapubic aspiration, the bladder is sometimes the collection of midstream urine specimen. The technique is used for mainly bacteriological examination and microscopic examination, but it's also used for routine examination of urine. Clean the discharge organ and rinse thoroughly with clean water or sterile line. Take in a clean and dry 300 ml capacity container for bacteriological examinations, and the sterile container is required. It's sterile because it's always using through sterile container. Once we used, we should not use either by clean or wash or any other uh, technique. The first part of the urine is discarding. The middle part of the urine is voided in the container, about 100 ml. Then the last part of the urine is discarded. As I mentioned, first and the last urine may discard or will not be collected, and the midstream will be collected. For bacteriology examination, don't add the preservative in the urine because the preservative may kill the microorganism present in the specimen or urine. Examination the urine specimen with 1 or 2 hours after voiding. If delay the test, the preservative is used for preservation of constitute urine and also refrigerate the specimen at 2 to 8 degrees centigrade. For in case we collect the urine sample, we should be reach the sample to the diagnostic center within 1 or 2 hours. Maybe we are too far away from the laboratory hospital. We should preserve the uh, container in the refrigerator with the temperature of 2 to 8 degrees centigrade. No preservation are required if the urine is examined within 1 to 2 hours after voiding. If delay is anticipated, the refrigerator but not freeze. Preservatives are required for 24-hour specimen collections. With 24-hour specimen are collected when the sample is to be mailed to a distinct laboratory for examination to prevent decomposition and contamination. It is necessary to add preservative in the urine. For example, the test is courier or send a parcel to other state or other cities. It may take more than 1 hour to more than 24 hours, maybe 2 hours, 3 hours, or 1 week. So in that condition, the microorganism may be dying. The, the composition which is present the abnormal composition, maybe the decomposition, destroy. So the preservative is very, very important. And the most of the preservative are bacteriostatic, that is, they create an unfavorable medium for the growth of the microorganism in the standing urine specimen. So many variety of preservative are available in these areas. So toluene, so use 2 ml for 100 ml of urine, and thymol or formalin or chloroform, so 1 drop of crystal for 30 ml, and the concentrate Cl, we use 10 ml of concentrate Cl for chemical examination, especially calcium and nitrogen content, and boric acid, 50 gram per 24 hours of urine sample, and sodium carbonate, and a commercial preservative tablets are used for 1 tonne per 30 ml of urine. And so these are the things which should be used for urine sample, which we are going to follow during the urine sample collection and preservation analysis, because urine is one of the important and the primary source of, of diagnosis of the patient, the primary level. Thank you.